Baby Zachary just turned 1. And life is one big adventure. For his mum, Amy, the roller coaster ride to parenthood started about 3 years ago when she decided to freeze her eggs.
The process was pretty full on, so I had to do 6 rounds of egg freezing. It was emotionally, physically and mentally very hard.
And then there's the financial toll.
I did get a Medicare rebate, but all up it was about $28,000.
Without the rebate, it would have cost around $40,000. She qualified for financial assistance because the procedure was deemed medically necessary, but she still had to withdraw from her super to afford it.
Early access to superannuation on compassionate grounds, and it was about $20,000 that I withdrew.
She's not alone. According to the ATO, 2,750 people withdrew more than $45 million from their super last year in order to afford IVF-related procedures, pinning their funds, hopes and dreams on reproductive technology.
These are the little incubators, and we have currently probably 20 to 25,000 eggs, sperm and embryos frozen in this room.
Business is booming at this fertility clinic, which has been designed to feel more like a hotel or salon.
Over the last 3 years, we've seen an increase in our egg freezing business by about 50%. We're finding that more women are choosing to egg freeze at a younger age, and they're choosing to do it as an elective process.
According to ABS data, the number of first-time mothers aged over 30 has been rising, from 15% in the 1980s to almost 53% by 2020. Overall, women are having fewer babies.
Total fertility rate in Australia has been declining since the 1970s. That's a problem for Australia.
According to the World Health Organization, 1 in 6 people globally now experience infertility. Reproductive technology offers a potential solution, but it's no silver bullet. While IVF can improve your odds of a baby later in life, your chances of success can still decline with age. Fertility specialist Dr. Lynn Burmeister says elective egg freezing should be subsidised the same way IVF treatments are.
Because if I have 30-year-old eggs, I will get them pregnant quicker than I will get a 40-year-old woman pregnant.
Egg freezing doesn't come cheap. Depending on the clinic, you'll likely pay between $5,000 and $10,000 per egg retrieval cycle. And then there's the annual storage fees of around $500. Dr. Molly Johnston from the Monash Bioethics Centre is worried it's not an even playing field.
Cost is one of the most limiting factors for access to egg freezing. A lot of people report that the costs are just too high for them to consider it.
Hey ladies, so we have the budget this week.
35-year-old Sydney-sider Molly Benjamin is the founder of financial literacy platform The Ladies Finance Club.
But also, just a quick update on where I'm at with the egg freezing. So I went in on Monday.
She's just come out of surgery.
This is a way that I can have control over my future and buy myself some time to find the right person.
Molly received a Medicare rebate because she has endometriosis, and her doctor considered the procedure to be medically necessary, meaning it cost her around $5,000 to extract 13 eggs. But across town, 36-year-old Alice Bichelle just paid around $15,000 for the procedure, deemed to be elective, and ended up with 5 eggs on ice. Both women believe the eligibility criteria for government assistance should be broadened.
The price is just so ridiculous. Why is it single women like having to pay for this on their own for their future, you know? Like, I just think there should be some sort of help from the government.
Women are already, we live longer, we earn less, we know there is a super gap, we're more likely to have interrupted careers. So when we then have to spend all this additional money on freezing our eggs, it puts us again in quite a financially vulnerable situation later on.
While IVF treatments can attract a Medicare rebate, it's not as clear-cut when it comes to egg freezing. There's no definition of what puts someone at medical risk of infertility, meaning it's up to the treating clinician to decide if the woman should qualify for a rebate.
This could be leading to somewhat of a doctor lottery, where one doctor may deem a cycle as being medically indicated and thus eligible for a Medicare rebate, where another doctor might not classify it as medical, and the patient would then have to pay the cost out of pocket.
My belief is that it should be subsidised by the government for all women and make it more affordable to all women.
Some people might say, why should I, the taxpayer, subsidise a 28-year-old woman who wants to freeze her eggs because she's panicking, she hasn't met anyone yet?
The average age of having a baby in Australia now is 31 or 32, around about that age. And so then their second baby is 35. And so if they had have had eggs frozen from a younger age, the taxpayer would actually be paying less than what they're paying for the IVF process at the moment.
But not all fertility doctors agree.
I think it's a can of worms because where do you stop? Who is eligible? What age groups are eligible?
At the moment, we're using whether there is a medical indication or not. And I think that a broader discussion needs to be had about whether that is justified, a criteria for giving access to this technology.
Not everyone who can access it will end up with a baby, but for some, it'll all be worth it.
Having Zachary, it's brought me so much joy in my life, and I never thought for sure that I would be able to have this baby.